And then Beth, you can start it.
All right, go.
All right, good afternoon, everyone. Thanks for joining us for Member Cafe. We are going to give it just a few more moments to let a few more people get signed in. I can see our numbers ticking up, so let's just wait just a moment. All right, good afternoon and welcome to Member Cafe. My name is Ann Gluff and I am with the member engagement team here at Partners Health Management. And our team is hosting this session for you today. Beth, you want to share our slides so we can move forward here? And then while she's sharing those slides, let me just introduce the members that are here with Member Engagement here. So again, my name is Ann Gluff. I'm one of the supervisors with Member Engagement. We have Beth Brooks. She is also supervisor. So yeah, just give a wave when I mention your name. We also have Melissa Hatton. Melissa is a Member Engagement Specialist, and she's going to be helping us here with presenting the cafe. And brand new to us, we have Tom Gray. He is Member Engagement Specialist, Committee Liaison connected to CFAC. And I am going to tell you a little bit more about that as we move on. And we have a few guest speakers as well. We have Brandy Lineberger. Brandy, want to just give a wave? And Brandy's our Population Health Manager. And then we have Shauna Barus. Shauna, you want to just give us a wave? There you go. So Shauna is our Mental Health Substance Use Care Manager, Supervisor. So let's go ahead, and I don't see the slides. There we go. Excellent. All right, so before we get started, I wanted just to go over a few housekeeping items for you. So number one, this meeting is being recorded. So I just want to make sure you're aware of that. You don't want to share any personal and private information during our session, but certainly if you would like to speak to one of our member engagement specialists or any of us, we'll be available for a few minutes after the session. You can also schedule a one-on-one session with us if you have any questions. And then also this session is being offered in closed caption. So if you don't need the closed captions, you are able to turn them off. So right towards the bottom of your screen, you should see a button where you can click on it, that the subtitles, and you can turn those off so that it doesn't distract while we're talking. And let's go ahead and go on to the next slide. And so I mentioned earlier, we have two guest speakers. So our first one, let me tell you a little bit about Brandy. She is our Population Health Manager here at Partners Health Management. She attended Gaston College of Nursing and Western Governors University and is a registered nurse, a faith community nurse, a certified dementia practitioner. Lots of things. Brandy has great background. Brandy has worked in various areas as a nurse, including intensive care, home health, hospice, long-term care, geriatrics, and behavioral health. Brandy has a true passion for behavioral health and population health, and she has served as a member of the North Carolina Institute of Medicine for Older Adults. It was a task force, the Council on Aging, and the North Carolina Home and Community Block Grant Advisory Committee in the past. Brandy also serves on many population-focused work groups dedicated to improving the lives of the entire population. Brandy is going to talk to us about diabetes prevention. So Brandy, I am going to let you take it from here.
So good afternoon. I'm so happy to be here to be able to present for Member Café. I have a passion for helping the population to be as healthy and well as possible. And so as a part of that today, I'm going to talk to you all about diabetes prevention. So the first thing I want to talk about is why it's so important that at your annual wellness visit with your primary care provider that you have a diabetes screening. Diabetes affects a lot of individuals in the United States of America. It is one of the leading causes of death. It's actually in the top 10 leading causes of death. And heart disease is closely related to that. And as many of you probably know and have seen, this is Heart Month. So, you know, wear red, right? So everybody's been wearing red, and we want to support that. And so as a part of that, we want to make sure that we stay focused on why diabetes screening is so important. We want to do some diabetes screening to help prevent heart damage, because if you do not make sure that you are aware that you have diabetes and it goes untreated, it can affect your heart and cause damage to your heart. Talk about risk. People that have bipolar disorder, schizophrenia, or schizoaffective disorder and take antipsychotic medications are at an increased risk for developing diabetes. Because of that, we want to make sure that individuals that have these diagnoses and take that antipsychotic medication, which is very much needed to keep them stable, we want to make sure that they do get regular screening for diabetes and detect it very early and reduce the risk of complications that can occur. And so with the diabetes screening, one of the things that Partners focuses on is the Hedis measures. And so that is healthcare effectiveness data and information set. And so Hedis measures are some measures that help us to be able to look and see what our outcomes are looking like and to be able to be sure that we're making an impact. And so as a part of that performance improvement measure this year at Partners, one of our strategic goals was focusing around diabetes screening for people with schizophrenia or bipolar disorder who are using antipsychotic medication. With that being said, because we are partners and we do care about our entire population, we're actually taking that a step further, and we're encouraging everybody that's at risk to get a screening. So when you do see your physician, make sure you mention to them that you would like to have a diabetes screening, just to make sure that you are on point and where you need to be with your health. What this performance measure actually looks at is it assesses adults that are 18 to 64 years of age with schizophrenia or bipolar disorder who have been dispensed an antipsychotic medication and had a diabetes screening test during the measurement year. So if you take those medications and have those diagnoses and you're between the ages of 18 and 64 and your doctor does a screening for diabetes, either through a hemoglobin A1C or through just a regular blood glucose screening, so where they check to see what your blood sugar is, that means that you are what we consider compliant for meeting this performance improvement measure. So that's where you want to be, is you want to be in compliance, because we do want to make sure that we recognize and find out that if you have diabetes early on, that we can make sure that we effectively treat that and prevent any further complications. And so now I just want to talk a little bit about what diabetes actually is before I go on to the screening part. So I will jump back over to that in just a moment. But with diabetes, your body doesn't process sugar quite as appropriately as it should. Your blood sugar can become too high, and maybe your insulin's not working as effectively as it should, or maybe your body's not producing insulin. And so that can be a problem. Just to go over some of the signs and symptoms. So feeling very thirsty, frequent urination, having to go to the restroom frequently, maybe having some blurred vision, cuts or bruises that are slow to heal. So if you say maybe, you know, you're cutting some vegetables in the kitchen and you cut your little finger and you have a scab and it just won't heal, and it just, you know, you're putting Neosporin on it or you're putting a Band-Aid on it and it just won't get better. Good time to check with your doctor and just make sure everything's good. Extreme tiredness, tingling, numbness, or pain in the feet and hands can be one of the signs or symptoms. feeling hungry frequently or feeling hungrier than you feel like you should, and also weight gain, or get this, weight loss. So weight loss can be one of the signs too. So just keep that in mind. And so here we'll go to what the lab testing is. So again, it's that hemoglobin A1C or that blood glucose test. Many of us have had our finger pricked, right? So you go to the doctor and they just do that quick little finger prick and they put it on that little glucometer and it tells us what our blood glucose is. That is one of the tests that can show. Or you could have your regular lab work where they draw blood from your vein in your arm possibly, or from a vein in your hand. And so they would just take that out. I won't say it's painless, but it's usually very quick. And so it does give us a good measure of what we're looking at health-wise. And so just to give you guys some ideas of how you can discuss that diabetes screening with your doctor if you feel that you're at risk. An open conversation is really good. And so since I speak on that, I do want to mention that, it's really important to make sure that you have a very good, open relationship with your primary care provider. You want to make sure that you can discuss pretty much anything with your doctor. And you should feel like you can go to them and talk to them and have an honest, open discussion about pretty much anything, because they are your doctor and they should listen to you. If you don't feel that you have that relationship, then you can always try to seek another physician that might be a better fit. Nothing wrong with that, no shame in that, because we're not always a great fit with every doctor that we meet with. So, that's okay. Don't feel bad if that happens. And talk with your doctor about complications that can result from untreated diabetes. Let them know, I'm concerned. I want to make sure that I'm as healthy as I can be to live the best quality life that I can. And then also getting advice on how to manage your condition and your symptoms. That's really important. So in the event you find out that you are either pre-diabetic or that you in fact do have diabetes, it's really important to have that conversation with your doctor to know, how can I take care of myself and manage my symptoms and my conditions so that I have the best quality of life possible. And that's just your little resource page there. It tells you where you can go. The CDC is a really good resource. They have a lot of free printable things that you can print off of there. And I actually have some of them. You won't be able to see it, but I have some tip sheets here that I like to refer to. And now we're going to talk about some tips for eating healthy with diabetes. And so, Beth, I don't know, have we done the poll yet by chance? Okay, so we'll see that a poll has been launched, and if you can answer that, that will be great. If you've already answered it, that's awesome. And Beth will give you just a few moments and then she will end it and we'll get some results. And so the first question is, what is considered a standard serving portion of lean meat? And so is it 1 piece of bacon, 3 ounces of lean chicken, or about the size and thickness of the palm of your hand, an 18-ounce ribeye steak, or a piece of bologna? And then the second question is, when eating a well-balanced diet, the CDC recommends that an individual fill 1/2 of your plate with non-starchy vegetables, 1/4 with lean protein, and 1/4 with high-quality complex carbohydrates? Or do they recommend that we eat a large steak and 2 cups of mashed potatoes? Or would they say maybe we should have a milkshake and eat 4 cookies? Or would we fill 1/2 of our plate with potato chips and the other 1/2 with bean dip? So these are made to be sort of silly because I wanted to engage everybody and get everybody kind of thinking. And so I think we know what some of these answers would be. And so Beth, if you want to end it, we can share some results. All right. So it looks like we did a really great job. So the correct answer to the first question is going to be 3 ounces of lean chicken, or about the size and thickness of the palm of the hand. So just keep that in mind. If you're, having an 18-ounce ribeye steak, you might want to make that several meals just to keep it healthy. And then when eating a well-balanced diet, the CDC does recommend that you fill half of your plate with your non-starchy vegetables, a fourth of it with your protein, and then a fourth with a complex carbohydrate. And we'll talk a little bit more about what that might be. And so some more tips for healthy eating. You want to make sure that you eat less saturated fat if possible. So you're going to look at eating baked, broiled, or stewed meats or fish if you're going to eat meat or fish. You don't want to eat fried if possible. It's okay to have it every now and then as a treat, but you don't want to have, like fried chicken 7 days a week. That's not always the best choice. And then you want to use non-fat or low-fat salad dressing, mayo, and margarine. And then you also, it's important to remember food that's healthy doesn't have to be flavorless, right? So you can add spices and things that are natural. You can add, Italian spices like oregano and rosemary and things like that. You can add garlic, garlic's very flavorful, and, as long as those things are sodium free, they're pretty healthy for you. So they won't really, have a huge impact. Also eating less sugar. So drinking lots of water, super important, right? We hear that all the time. You should drink a lot of water, keep yourself healthy. Also sugar-free soda can be a good choice if you're going to choose a soda, or unsweetened iced tea instead of a fruit drink. Or instead of drinking regular soda or sweet tea. And that's sad because we live in the South, right? And most of us do love sweet tea, but hate to be the bearer of bad news, not exactly the best choice for us. And then as far as eating healthy portions, we did say that we would talk about that. So as far as the protein goes, you do want to look at eating about 3 ounces. So it's going to be about the size and the thickness of the palm of the hand. So just this right here. Very, not huge. So it's going to be about 3 ounces of lean meat is what you're going to eat for a serving. And then as far as your non-starchy vegetables, that's going to be your greens. So any kind of salad greens, so kale, turnips, collards, butter lettuce, all those really good lettuces, the mixed spring mix, even iceberg lettuce, all of those are full of vitamins and nutrients. Do keep in mind the darker and the leafier the green, the healthier. So that's the better choice. And then as far as complex carbohydrates, you're looking at things like brown rice, sweet potatoes, things like that are really good complex. Think straight from the earth. So if you can pull it out of the earth and it's not processed, then it's obviously going to be a lot better for you. And then just to talk about grocery shopping. So something we all have to do, right? Not my favorite task, but definitely something we all have to do. So when you're grocery shopping, making sure you're looking at labels and reading labels. The most important and hardest thing to do when you're looking at a label is you have to look at the serving size, right? So that bag of chips, it might have 4 servings. And we sometimes might be, sitting, chilling, watching TV, and we're going to eat the whole bag, right? So that's not exactly the best idea, because you could easily be eating, more than 100 carbs if you ate that whole bag of chips. So just making sure that you pay attention and are aware of serving sizes. And some of the things to do when you're thinking about planning your meals is to plan. I always said this, if you fail to plan, you plan to fail, right? So it's important to make sure that you're thinking about your meals and, thinking about what you're going to eat before you're starving, because if you wait till you're super hungry to think about what you're going to eat, you might make some not so great choices. So it's better to be prepared and think ahead of time. And also when you eat out, making sure you make good choices there too. Oftentimes the food at restaurants, when they bring your plate, it's a huge portion that could be divided into multiple different meals. And so you could have, 2 to 3 meals off of that one meal that you're getting at a restaurant. So keep that in mind. Talk about weight loss. So just losing 5% of your total body weight can help to reduce your risk for diabetes. So that's important to note. That's, it's not such a terribly hard thing to do. So if you were going to lose, let's just say that you weighed, I'm just going to throw this out there, 240 pounds. So to lose 5% of your body weight, that's only 12 pounds. So that's pretty small. That's not a huge amount. And you could do that by making really small changes like drinking more water, eating more leafy greens and your complex carbs and your lean proteins, and moving just a little bit more. I know all of us are not able to get up and run a marathon, but we can move our arms while we sit in the chair. You can move your legs some. You can do what you can do to try to be a little more active. And so that's very helpful as you try to be more healthy. And then the other thing I wanted to talk about is, we all crave something sweet, right? That just happens. Inevitably, you're going to want something sweet. So what you can do is choose a fruit. You could choose to eat an apple, an orange, a banana, some strawberries. So even though those do have carbs, they're a whole, like I said, from the earth type of food. And so when you choose that whole fruit, it has fiber in there. That's going to slow down digestion. It's going to make you feel full longer. And it's also going to help with that sugar absorption so that you don't absorb the sugar too quickly. It's very different than eating just a piece of candy, right? Because you have the fiber and all that good stuff. And then not all that, think about all the vitamins too. So lots of vitamins in there. Cooking. So cooking at home can be super fun, right? You can do it as a family. You can interact and do things that are fun, and you can make it about a healthy mealtime. And so you can, as a family, make good choices on what you're going to prepare, and then prepare it together and spend time together, and then eat that healthy meal. And so that's a really good thing to keep in mind. Portion sizes, you can use your hand. You don't have to have the measuring cups. I don't know about y'all, but the measuring spoons, the measuring cups at my house, they just disappear. They just go. So they're just gone. So you can use your hand. So ways to look at it, of course, like I talked about, the palm of the hand, that's for your meat, right? That should be the size of your meat. And then if you look at an ounce of meat or cheese, that's going to be the tip of your thumb. So right here, that's what your serving of cheese should be if you're just going to eat, a little bit of cheese and maybe an apple. 1 to 2 ounces of nuts or pretzels, that is a cupped hand. So just the very center here, not spilling over, right? Not running onto the counter, not strategically placing them like a pyramid, just putting them in the center, and what you can cup is what it is. And then also to note, that's a tablespoon. So if you're cooking and it says you need a tablespoon of peanut butter, that's a small tablespoon, guys. Look how little. That's a small tablespoon when you're making a peanut butter sandwich, but it is a tablespoon. And then a teaspoon is going to be your fingertip. So right here. So if it says to add a teaspoon of garlic, that's going to be your teaspoon. And then of course your fist. Your fist is going to be a cup. So that's a lot of greens. Going to eat some, leafy greens. You want to eat a whole fist of leafy greens. So keep that in mind. Make sure I'm not forgetting anything I wanted to tell you guys, because I have great information to share. The other thing I wanted to talk about too is keeping a record of what you're eating. So I did this and I was shocked at how much I was overeating. If you just keep a little journal and write down what you eat all day and then look back at it, it helps you to know and be cognitive about what you're putting in your body. And it can also help you to make relation to I ate a Snickers bar and an hour later I didn't feel so good, or I had a salad yesterday and then I had lots of energy. So you can make correlations. So I do encourage you to keep like a little food journal. And then one of the last things that I want to talk about is some of the feelings that might happen. So let's just say that you do get that diabetes screening and the doctor says, I'm going to use Beth. I'll pick on Beth. Beth, I'm so sorry, but you do have diabetes. Your A1C is high. So Beth might feel angry. She might get upset. Completely normal. Totally normal. Don't think anything's wrong with you. That is totally normal to feel that way. And so some things you can do if you do have that is, you can take a deep breath, talk to a friend. We all need to vent at times, right? Vent to each other. Sit back, relax, shake it off. I literally sometimes just shake my arms to shake it off. You got to just kind of, let it be. One of my fun things to do is dance. So dance, release some of that energy. You can do some art, listen to music. any of those things. You can do all kinds of different activities to try to, help yourself to feel better. But there's, never minimize the benefit of talking to somebody. So, calling. Another thing you can do is the Pix Health app, right? You can talk to the Andy. So Andys are always there. So you can call, talk to an Andy, let Andy know how you're feeling, get some support from the Andys. That's a great thing to do. Another thing that can happen is denial. And so as with any health issue, when you're first told that you have a health issue, it can be a little shocking. Not good to hear, not fun to hear. And saying, I don't have diabetes. Doctor said I had diabetes, but I don't think I have diabetes. My A1C was just a little high. My fasting blood sugar was only 150. That's not that bad. Well, it might not be that bad, but if you let it go, it can be bad. So, things that you have to be aware of is, making sure that you're thinking about it and that you meet it head on and that you prepare yourself to tackle that. So I like to look at it like a challenge, right? So I'm going to beat this. Like, I'm going to do the best I can to make sure that I'm as healthy as I can be. So that's kind of that mindset that you want to take on, is just making sure that, you do that. And then the last thing that I wanted to talk about is sometimes depression can come into play. So some depression can sneak up on you. It can sneak up on anybody. It does not pick and choose who it affects. So just know if you start to feel some of those feelings of depression, like loss of interest or pleasure in things, a change in sleep patterns, waking up earlier or later than normal, not wanting to sleep or wanting to sleep too much, trouble concentrating, a loss of energy, if you start to feel nervous, if you have some guilt, which is, it happens, right? It can happen. You start to feel some sadness. If you end up with some suicidal thoughts, those things have to be addressed. If you withdraw from your friends and activities, or if you decline school and work performance. So like if you notice I'm not doing so good at work, or I'm not doing as good in school, that's something that needs to be addressed. So it's important to reach out. You can call the Access to Care number. You can reach out to an Andy for support. You can certainly call one of us or member engagement staff. No wrong door. We will get you pointed in the right direction to get what you need to make sure that you're healthy and well. And with that being said, sometimes at Partners, you have a care manager. And so that's why Shauna's here, because she's going to talk about how care management can help, and how interactions with your care manager can help facilitate and make things with diabetes hopefully a little easier. So I will turn it over to Anne, because I believe Anne is going to introduce Shauna now.
I am. So thank you, Brandy, for all of that great information. So before we move on to Shauna, I wanted to see if anyone has questions for Brandy. I neglected to share with you as we started out that if you had questions to pop them into the Q&A on your screen. So Beth, are we seeing any questions coming in?
Not yet.
I did not do that great. I know somebody has a question. I will say too, my email address and my phone is always available. So if anybody ever has a question, feel free to reach out to me. I love to talk, as y'all probably noticed, and I love to talk to people. So I am here to support you and help you.
So Brandy, I have a question for you. You had mentioned carbs when you were talking about nutrition and eating and all of that. And I don't want to put you on the spot or anything, but are you aware of the number of carbs that, a typical person should eat in a day, and then versus someone who has diabetes? I know that's something that you really have to focus on when you have diabetes.
Yeah, so that's a great question, Anne. So generally, the suggestion is around 45 to 60 carbs per meal for 3 meals a day. And then you're going to want like a 30 carb snack twice a day, up to 3 times a day, depending, of course, on your body, your weight, your size, your mass, and things like that. That is if you're non-diabetic. Sometimes doctors will prescribe for diabetic individuals for them to have 30 to 45 carbs per meal 3 times a day, and then 15 to 30 carb snacks. And with someone who has diabetes, sometimes the bedtime snack is the most important snack of the day, because that snack can help their blood sugar to not rise overnight with what we call a sunrise phenomenon. So we don't want them to have that surge, because what happens is when it shoots up high overnight, it drops low, and then you feel really bad. And so that's pretty much what the recommendations would be. It is, of course, very individualized. So I encourage everyone to talk to their doctor, or also to their dietitian, or to there's some diabetes programs that are out there that are available that you can attend. Some of them are actually free through some of the public health departments. And then there's also the American Diabetes Association. You can always refer to them to look and see what their meal guidance is for someone with diabetes. But again, it's very individualized, and it depends really on your diabetes and how that's to be managed. And then as far as folks that don't have diabetes, it could be varied too for them, because really your blood sugar can be impacted very differently depending on how your body chemistry is. So hopefully that's helpful.
Right. Thank you, Brandy. I appreciate that.
So Brandy, we do have a question. It says, what about if your blood sugar drops low in the 40s or high 30s?
Yeah, so that is actually what we would call hypoglycemia. And so that's actually very, very risky too. And so that's something that you definitely want to talk to your doctor about. And it doesn't hurt to have, meals that have, it's really important to have meals that don't just have that complex carbohydrate, but also a meal that has protein, because protein is what's going to keep your sugar from dropping over a long period of time. And so it's also really important to make sure you're eating very frequent meals. So you're going to want to eat, at least 3 meals a day and several snacks, and it's going to need to be at regular intervals. So it's really important not to skip meals if you're having low blood sugars. And I do encourage the individual to make sure they're following up with their physician, because blood sugars that low can be very dangerous sometimes. And so it's really important to know their body and follow up with their doctor.
Great. Thank you, Brandy, for all of that great information. So
Thank you.
It looks like we're clear in the questions. Is that right, Beth? All right. So let me move on further and introduce our next guest speaker. So Shauna Barus is our MHSU Mental Health Substance Use Care Manager Supervisor. Shauna is a seasoned healthcare worker with over 14 years of customer service, leadership, and project management experience in the mental health substance use field. She's been employed with partners for 9 years in the care management department. Prior to that, she worked at Broughton State Hospital as a charge nurse. Currently, Shauna supervises a team of care managers that work on special projects, as well as provide community care management. So I'm going to let Shauna take it from here, and she's going to share with you about MHU care management.
Thank you so much, Ann, and thank you again, Brandy. Those were some great tips, and I took some notes that I needed to rehear again, unfortunately. So thank you again. So good afternoon, everyone. Again, we want to discuss care management and just give an overview of care management. Just a quick disclaimer, Partners does care manage a lot of different areas. This particular one is going to focus on the adult population, but I did want to let you know that we do, with care managers, have community care management. We have children and complex needs care managers. We have care managers that work with DSS and DJJ liaisons and family partners. And finally, we work with the transition to community living. So those all will be hit at other community cafe presentations. So definitely keep your eye out if something in those areas interests you or you have questions about that. Always know that you can reach out to us before then, but I look forward to seeing those also being presented on the community cafe. So just a question, what is mental health substance use disorder care managers and what do we do? Care managers is designed to help members develop a plan to meet their goals and recovery for their life, to help members access services related to the behavioral health and physical health care needs. Members, along with their care manager, work together to identify what's important to the member and create a plan and how to achieve it. Now, I know that says a lot, but just know that if you have a care manager or if you're in need of one, please reach out to us. We're here to help, and our goal is your goals. So we want to make sure that you are so successful in life that you're able to do and reach whatever makes you happy. And so we want to make sure that we're able to help get you connected to the right services so that those goals can be achieved. So also with care managers, what our role is we educate about available behavioral health and physical health services. So if you're in need of a primary care physician and you're not sure who to reach out to, ask your care manager. We can help get you a list of active providers in your area that are looking for new members, new patients. So please don't hesitate to ask us to help you with that resource. We also verify and also the compliance of members who are on outpatient commitments or substance use commitment orders. So sometimes when members leave the hospital, we follow up to make sure that you're making sure you're attending your appointments and that those are all being addressed. We link members to psychological, behavioral, education, and physical evaluations. So if you're in need of some assessments, we can connect those to the right providers who are doing those in your area. We also review those assessments and health history, the person-centered plans and crisis plans to reinforce to the members so that they receive the appropriate services that they are in need of. And also the correct clinical assessments are being completed on members to ensure that you're getting all the service providers that you need. We collaborate and we individualize your treatment plan, and we gain access to clinical and medical specialists. So again, if you are in need of a primary care physician or you're working with a primary care and you feel like that you need a nutritional referral, we will connect you with someone who is taking on new members for nutritional education purposes. We can connect you with community resources that you can have guidance with. We organize providers and stakeholders to address the needs that the members have in the community. So we want to make sure that there's no gaps in the services in the areas that you need. And that is a huge barrier for a lot of our members here recently. Care managers work with inpatient facilities and crisis centers, and also the jails and prisons. We want to make sure that they are participating in their discharge planning. We want to ensure that if you leave the hospital, that you do have an appointment set up to follow up with within 7 days to ensure that you're getting those continued services, because your success includes being a part of a service plan and meeting those needs after you've left the hospital. And we also will be connecting with you after you've left the hospital to ensure that you've made that 7-day appointment. And if not, we're going to strongly encourage you to get connected to a provider. And if you're not sure about the provider that they linked you with, we can provide you education on that service, or we can help you find someone that you feel that might be a little bit better fit for what your needs are. So please don't hesitate to ask. Say, you've been discharged from the hospital and they've connected you with a provider and you've not had good interactions with them. Tell us and we can help get you to someone else. It is okay to say that provider and I just do not work well together and we need to look at other options. So please don't hesitate to ask us. We're in it for you, and we want to make sure that what you're needing and what you're getting is what truly will be successful for you. How are members selected for care management is really a good question that comes up. So we wanted to make sure that you knew that members are selected to participate if they meet some of the following criteria. Have more than 3 crisis contacts within a 12-month calendar year. So if you're calling mobile crisis and you've done that 3 times in the past 12 months, you're going to probably get a call from a care manager. We will start trying to, see if we can get you connected with services if you don't have a primary care, a behavioral health provider. We'll try to help figure out with you, what seems to be facilitating the crisis events, see if we can help give you some education or some resources to work around those. We also receive referrals from inpatient and detox crisis centers, hospital admissions for care managers. So if you have been inpatient recently, or you've been in the hospital, in the emergency department, you're probably going to be getting a call from a care manager that's been assigned to you to see if we can help with your success and get you connected to services once you've been discharged. And also members who have high behavioral health care needs or physical health needs. And I know that seems a little off, being a behavioral health provider. As the state moves towards transition of care and tailored plan and standard plans, our role is going to be whole person integrated care. So we want to make sure that we are hitting every piece of you. And that could include spiritual, that can include behavioral health, physical health, just any of those pieces that make you you. We want to make sure that we're addressing and seeing and hearing and helping you find what you need to be successful. Community resources, all those are available that we are looking for, we can connect you with. We have resource guides that we utilize, Aunt Bertha, which is a public site that you can go on and pull up and look for any kind of resources within your community, be it housing, transportation, clothing, food banks. And then we also use NC Live, and I think it's NC Live Connect maybe, that we use to connect. And they will also do referrals within that system to ensure that someone is following up. So if you reach out to me and say, Shauna, I need help with finding food banks in my area, there's just nothing that's close enough for me to be able to get to, I can go in there and I can set up a referral for that system, and they're going to follow up, and I'm going to be able to follow up to make sure they reached out to give you what you need in your area. And if they're not, I will be following up with them to find out why, and I'm going to still make sure you get what you need. So also with care management, members are identified through those resources, but also for reviewing some data. You may be going right now into the hospital for medical needs. Diabetes is a huge one. So if you're going inpatient repeatedly because your blood sugars are not, faring well, you're probably going to be getting a call from one of the care managers to see if we can't help get that connection made. What is not working? What can we help assist you with in getting that service in place? Again, if it needs to be nutritionist, if we need to look at having conversations with your providers, just anything that we think that will help reduce your inpatient hospital stays, because we all know that being in the hospital is not fun. That is not your end goal, and that's not where you truly want to be. So we want to make sure that we are able to hit all those areas to ensure that you do not have to utilize those hospital stays. But again, if you do need the hospital, we want you to be able to use it and know that we're going to be there to help you while you're there and then once you leave. And then also we get referrals coming in from external providers. Again, we work closely with another agency called CCNC, it's North Carolina Connects, and they right now do most of the medical piece of it, but we've worked with them for several years. So if they feel like that you need more services than they're able to assist you with, they're going to send me a referral, and we're going to be reaching out, contacting you to see if you're interested in working with us as well. So who works with the member whenever you're working with care coordination or care management? Members work with a care manager who is familiar with the behavioral health system. The care manager also works with the member, the family, legal guardians, service providers to ensure that the members are receiving the services that they need. And of course, those other pieces of the puzzle are all based on a release of information from you. So if you don't want us talking to your service providers or your family members, we won't. It all depends on whether you want us to or not. We get that release. And also, it's up to like I said, it's up to the member to decide who you want to have working with you. And people don't think about it, but sometimes your family truly isn't your best cheerleader or your best advocate for you. But your neighbor down the street who you confide in are people that you want to have in your corner. So we want to make sure that if you want them, that we're there to help you with that. So don't dismiss everybody that you work with in your life as being your cheerleader and who we can connect to make sure that you're being successful. And also, how does this affect your current providers. So if you're already connected with a provider in the community, care manager will work closely with them and you. It's not that we're trying to take their place. We just want to make sure that they're hitting everything that you need. And our goal is we want to make sure that the journey towards a healthier and more fulfilling life for you. So our end result, again, is your success. Care managers also want to ensure that we reduce those service provider or those crisis services. And we want to make sure that you have smooth transitions back into the community. Again, if you're in the hospital and you're going back into a situation that, you know, basically is the same thing that got you in the hospital, we want to try to help you mitigate those areas and work with you on being successful and how to navigate those community barriers. And the final thing is, are you required to have a care manager? And the answer is no. You know, if you get assigned a care manager and you're just not in a place that you want to be connected with one, it's okay to say no. We're just going to make sure that you know that we're there. We're going to give you a phone number to follow up with, and we want you to reach out to us as you see fit. So even if you say no now today, it's okay to say yes tomorrow. So please don't forget about us. We're here for you. If you go inpatient, we're going to call you. We're not going to, you know, pick up the phone and call me back. You know, we're not going to be that kind of person, but we are here for you when you need us. And when you decide to reach out, we will answer the phone and be here for you again. So with that said, if you have any further questions about care management, or you want to make a referral for care management, you can always contact us through our access line, which is 1-888-235-4673, or you can go to our website and there are instructions there on how to do a referral for care managers. So is there any questions for anyone?
All right, thanks. Thanks, Shauna, for that great information. Sounds like Beth said she didn't see any questions yet, but this is your moment. So if you have any questions for Shauna, she is an expert on care management and will be able to field your questions. So if you've got anything right now, go ahead and pop it into the Q&A, or you can use the raise your hand feature and we can unmic you in or mic you up, let's say, and so that you can ask a question. My words are getting all mixed up right at the moment. So it was just listening to all that great information.
So we do have one question that's come in.
Okay.
If someone needs assistance in filling out referral forms, would care management do that? If not, who can assist the person with that?
So if you need assistance completing the referral form, the access to care would be the best way to do that, because they can fill it out for you while you're on the phone with them. So if having issues either printing it out or reviewing it online, just call our access to care and they will be happy to assist.
Great. So Melissa put that number into the chat feature so you can grab it and copy and paste it if you want. And just as a reminder, it's 1-888-235-HOPE or 1-888-235-4673. All right. Well, great. So we have just about 10 minutes left. So let me go ahead and share just a little general information about partners and about member engagement. So our official name is Partners Health Management, but most often out in the community, you hear us referred to just as partners. So we are very proud to share that we are a managed care organization. We're a health plan, you know, kind of like an insurance company. We are contracted by the state to manage Medicaid and state funding and some other funding sources. So you can think of partners as kind of part government agency and part health plan. But I do want to tell you that Partners does not directly serve individuals. You don't come to Partners to see your doctor or your therapist. Instead, we have a network of providers that provides the service directly to you, and they work together with us and they contract with us to provide that treatment. So all of the money that we manage here at Partners right now is focused on serving the behavioral health care needs for you and others in your community. And you heard Brandy share that great information about diabetes and Shauna talk about care management. So as we move forward, as you may already know, North Carolina is going through a transformation with Medicaid, and we're really moving towards that whole person care, which is why we really want to share with you about things like diabetes. So our goal here at Partners is always to improve the lives and strengthen communities by focusing our positive outcomes on our members. So Partners serves 14 counties. You can see them there listed on your screen. All counties in North Carolina have a managed care organization similar to Partners. So with these 14 counties, if you have questions about your county in specific, you can email a question to countyquestions@partnersbhm.org. I see Melissa is dropping that great information in the chat for you. Or if you have a county question specific, you can call 833-589-2184 and to pose your question. You can also go to welcometopartners.com to view any previously recorded events and information. So I want to move on and talk a little bit about member engagement. So we in member engagement, we are sponsoring this event for you. This is one of the many things that we do to support our members. So we provide customer service. We're an extension of our call center that we've been mentioning, that 1-888-235-4673. So we support our members kind of more one-on-one for those who don't know really who to talk to, maybe need some additional resources. We always support member empowerment initiatives, provide advocacy and education and navigation for North Carolina's public behavioral health and IDD healthcare system. So our staff, we build strong relationships with our internal departments, such as population health that's here with us today, and care management. We work together with our providers and other groups in our community. Again, all focused on our members and supporting to make sure that you are able to have the support and treatment that you need. We work together with individuals and families and agencies to directly support our members. So if you want to contact member engagement, if you look right here on the screen in the center, there's the number for member engagement directly, 704-884-2729. When you call this number, you will get a member engagement specialist to answer live. That's always our goal. If we are all busy, it's going to go to voicemail and we're going to get back with you within 24 hours. And so you're welcome to call us Monday through Friday during business hours. If you have questions outside of business hours, our access to call line that we've mentioned a few times, it is available 24 hours a day, 7 days a week. And if you have a need to connect with member engagement, they're going to get that information to us. You can also send an email to memberquestions@partnersbhm.org to answer your question, and we in member engagement are going to reach out to you with your answer. You can also find us on social media, Facebook, Twitter, Instagram. You'll see Partners out there. All right, so earlier when Brandy was talking, she mentioned Pix Health. I don't know if you picked up on that, but she mentioned talking to an Andy. So what is Pix Health? Pix Health is a mobile app that you can download to your phone. It is to help you monitor physical and mental health. So I really encourage you to register. If you want to download, you can go to the website. You can see right there in the center of your screen in green, and Melissa is dropping that into the chat for you as well. You're going to go to www.hipix.com and go to that app store, and you'll be able to download it. Once you download it, what it does for you is it helps you access resources, gives you some helpful tips for a healthier life. It focuses on daily mood and wellness check-ins, screenings for depression, anxiety, loneliness, and messages and assistance through the app. Or you can call what's called their Compassionate Support Call Center to chat with someone. All the folks who answer that line are peers. And what that means is they're individuals that have experienced mental health issues, depression, anxiety, loneliness, all of those things. They have lived experience, so they're there to talk with you. They also send referrals to our member engagement team here at Partners, so we again can support you even further. The other fun things that are on Pix Help are some research-based games and activities, and they really do promote good mental health. So I really encourage you to grab Pix Help and see if you enjoy working with it. So just a little bit more information. Super important, who to call. So we've shared several times the phone numbers on who to call if you need assistance. The other reason you might want to give us a call is if your contact information is changing. Super important to share that with us. We may need to get a hold of you for information about your health plan. The other super important thing is if you have Medicaid and you're working with your Department of Social Services in your county, DSS, if your contact information changes, please, please, please reach out to them and change your information with them, because they do send you information on a regular basis about changes with Medicaid. You can also reach out to member engagement for help with that. Again, 704-884-2729, or email us at member questions. So next I wanted to share with you about the Consumer and Family Advisory Committee. Tom, if you want to just raise your hand there and give us a wave. Tom is our new member engagement specialist committee liaison, and he's going to be working really closely with our Consumer Advisory. That's a lot of words for me right now. I'm going to go with CFAC. So CFAC is a volunteer group. It's made up of members and family members, and they represent those that are recovering from mental health, substance use, traumatic brain injury, or maybe have family members with that and IDD services. And so they are there to advocate on behalf of those individuals and to improve our public health system. So if you want more information, we are looking for additional members to the CFAC. So if you are interested and want more information, you can contact Tom Gray. There's his phone number right there on the screen, 704-884-2646, or you can email him, tgray@partnersvhm.org. You can also find out more about CFAC by visiting our website. There's a link right there for you. If you go to partnersvhm.org and go to Consumer Family Advisory Committee, and you'll find that under the tab that says Be Involved. All right, so stay in touch with us. I already talked a little bit about that. So that is all I have for you today. So if you have any general questions right now, now is a great time to ask them. So Beth, do we have any questions coming in?
We did. We have one question. Will Access to Care even fill out referral forms for recommended community supports?
That is a great question. And so referral forms for recommended community supports. I am going to say that member engagement would be a great place to call to get support on that. And other than that, I am not familiar with Access doing that. Beth or anybody else on the call, are you familiar?
I'm gonna say no. If member engagement's not able to assist you, then I'll, definitely ask for care management. We can definitely assist with that. So please don't hesitate. They will transfer you probably to one of the supervisors. If they don't answer, be sure and leave a message about what you're asking, and they will get back in touch with you, like they said, within at least 24 hours or sooner. You may get passed around a couple of times trying to get you someone live to talk to. So please don't hang up on us. Give us a chance. So we will definitely get back with you on that.
Thanks, Shauna. And I will tell you, in member engagement, that really is one of our main roles, is to answer questions for you and to support you in the community. So either way, care management, member engagement, and again, our goal is always to answer live. Or respond to a voicemail within 24 hours. Any more questions coming in for us, Beth? All right, so we are right at time, right at 2 o'clock. So thank you all for joining us today for our member cafe. And I want to give a big thank you to Brandy Lineberger and Shauna Barus for joining us today and sharing great information with us. Let's see, next month is March, and we are going to be focused on, Beth, remind me who our focus is for Member Cafe in March.
It is tools for your mental health toolbox.
Right. We are going to be focusing on what you can have in your toolbox, some self-management skills, and going to do a little bit deeper dive into PICS Health. So we hope you can join us then. So thanks for joining us, and you all have a great rest of your day. Bye-bye now.